Hi guys, Rachael Cook, Doctor of Audiology at Applied Hearing Solutions in Phoenix, Arizona. And in today's video, we're going to be talking about how your tinnitus could be coming from your jaw. Coming up. Roughly 5 million Americans experience tinnitus, a ringing, buzzing, or humming sound that isn't actually present in your environment. While many people can just ignore their tinnitus, nearly 2 million Americans suffer from severe tinnitus that can impact their sleep, their work, and even their concentration. Tinnitus is wildly unpredictable, often occurring at different levels, pitches, and even balance between ears from person to person. Understandably, this has made it hard for researchers to pinpoint the underlying causes of tinnitus that could lead to treatment solutions. However, the last 20 years of research has confirmed the most common cause, finding that nearly 90% of tinnitus sufferers have some form of hearing loss. When treated through the use of properly programmed hearing aids, over 60% of individuals saw a noticeable relief of their tinnitus. And if you want to learn more about that, you should definitely check out my video on this topic that will be linked down in the description below. Because hearing loss and tinnitus are so highly associated, the first step for any person with bothersome tinnitus should be a comprehensive hearing evaluation. During this evaluation, hearing loss is identified and proper treatment recommendations are reviewed. But what about individuals without any hearing loss? Or those that have hearing loss and had it treated appropriately, but still suffer from tinnitus? In these instances, we have to look beyond the ear to other causes of tinnitus, such as blood pressure issues, head injuries, ototoxic medications, cervical spine tension and injuries, and last, but certainly not least, disorders of the jaw. But before we dive into the 3 ways that your jaw could be creating or increasing your tinnitus perception and what can be done to fix it, please take a moment to give this video a thumbs up to bring videos like these to a wider audience. And if you haven't yet already, hit that subscribe button with notification bell so that you never miss any one of our newly released videos. We really appreciate it. Now, let's begin with a brief review of the anatomy that's responsible for this connection between your jaw and tinnitus. TMJ stands for the temporomandibular joint. This is the hinge that connects your jaw to your skull. This joint gets a lot of daily use between talking, eating, drinking, and even breathing. If you hear someone say that they have TMJ, they likely mean TMJD, or temporomandibular joint disorder. TMJD can be caused by genetics, arthritis, inflammation, overuse, autoimmune conditions, chronic teeth grinding, and jaw injuries. This condition is characterized by the inflammation of the nerves, ligaments, and muscles that surround the temporomandibular joint. This inflammation not only creates pain and tension in the jaw, but can also cause issues with hearing and tinnitus. But how could this be? The first way that TMJD can create or increase your tinnitus is due to the close proximity between your jaw and your ear. Because these systems are so close to one another, they share several nerves that are important for sensation and motor control. These nerves include the vagus nerve, the trigeminal nerve, and the facial nerve, among others. Inflammation within the temporomandibular joint can cause adverse sensory sensations. This includes physical sensations like pain and tension, as well as auditory sensations like tinnitus. This shared impact on the nerves can even be seen in rare instances of severe dental infections or abscesses, creating or increasing tinnitus perception. The second reason TMJD could be causing or increasing your tinnitus perception is because muscle tension creates changes in blood flow. This can directly influence the blood that should be traveling to the auditory system. The cochlea, your hearing organ, depends on consistent blood flow in order to operate correctly. Changes in blood flow patterns can interrupt your auditory system's access to oxygen in the blood that's needed to hear your very best. This is why blood pressure issues are also highly associated with an increase in tinnitus perception. Inconsistent and unreliable blood flow to the cochlea can cause hearing loss and tinnitus if left untreated. The third reason TMJD can cause or increase your tinnitus perception is due to Eustachian tube dysfunction. The Eustachian tube is a small tube connecting the back of the throat to the middle ear space. This tube opens and closes nearly every time you yawn or swallow in order to equalize the pressure between the outside world and the middle ear space. Balance in pressure is not only for comfort, but also for hearing correctly. Pain and inflammation in the jaw from TMJD may limit your ability to open and close your jaw effectively. Without this regular movement, the eustachian tube is unable to open and close reliably to equalize pressure. An inability to open and close the eustachian tube consistently can result in ear pressure and fullness, as well as temporary hearing loss and tinnitus. Now that we know what TMJD is, what causes it, and how it's associated with tinnitus, let's talk about how you can treat it. After obtaining a hearing test to ensure that hearing loss is not the culprit for your tinnitus, your hearing healthcare provider may suggest further assessment by an ENT physician or your primary care doctor. Medical doctors can order a variety of tests to further assess your condition and can initiate referrals to providers within different specialties. For example, a pharmacist would be able to review your medication list and ensure that your medication does not have bruxism, a chronic clenching of the jaw, listed as a side effect. Additionally, dentists and orthodontists are the experts when it comes to conditions of the teeth and jaw. Be sure to talk with your dentist about any TMJ discomfort or excessive clenching or grinding, as they may be able to provide custom splints or mouth guards to prevent this. Your TMJD could even be the result of the misalignment of your jaw, which can be assessed and treated by an orthodontist. Many dental professionals even specialize in treating TMJ disorder, so be sure to do your research on providers in your area. Other specialties that may be consulted include physical therapists and massage therapists. These professionals can provide individualized movements and stretches for the jaw that can help alleviate pain and pressure. While tinnitus is highly related to hearing loss, it's important to remember that tinnitus is often due to a combination of several factors. Treating tinnitus may require a team approach involving a few different specialties in order to develop an effective tinnitus treatment plan for your specific situation. And any reduction in the perception of your tinnitus, no matter how significant, is worth it to move the needle closer to finding your own cure.